Hello, this is Kim Jong-il. Today, we will look at the treatment of rotated posterior teeth as the second part of management of tooth rotation. Unlike the treatment of rotated anterior teeth, more space is required to treat the rotated posterior teeth. Therefore, in order to align the rotated posterior teeth, the rotated space must be reduced. How much space is needed depending on which tooth is rotated and how much? The rotated molar can be divided into a premolar area and a first or second molar area. It can be seen that the upper second premolar has insufficient space to erupt due to the mesial rotated maxillary first molar. If the rotated maxillary first molar is derotated, it has created space for the second premolar to erupt. In the last lecture, we studied about couple force system, rotation wedge, rotation loop, and spring retainer. Two factors are important as a treatment method for rotated posterior teeth. The first is strategic leveling and alignment. The second is the couple force system. Couple force system is to apply two parallel forces in different directions. Attach the bracket to the buccal side of the rotated tooth and attach the lingual button to the palatal side, and then pull them in different directions. The buccal side is pulled distal, and the lingual button on the lingual side is pulled mesially to derotate the rotated tooth as shown in the figure. It moves the teeth by simultaneously exerting force on the labial and lingual sides of the teeth. Tooth 35 is mesially rotated. Attach the lingual button to the lingual side of teeth 34 and 35, and then use the power chain. At the same time, attach the lingual button to the buccal side of the tooth 35, and then use power chain between the buccal side of the teeth 35 and 36. Like this, derotation is performed by applying a couple force system to the rotated tooth. At this time, let's think about where to attach the lingual button. To derotate mesially rotated teeth, the buccal side must be moved distally, and the lingual side must be moved mesially. The position of the lingual button can be attached like BCD. If you attach the lingual button as shown in D, the power chain force acting on the teeth is weak. It is best to attach it as shown in B, but it is not easy to use the power chain. Therefore, it is recommended to attach it as shown in C in clinical practice. When using a power chain to solve the rotating teeth, it is more important to use the couple force system than the position of a lingual button. Therefore, when attaching a lingual button, make sure that the energy chain is well hooked on the button. When doing management of rotated posterior tooth, I use two methods together. The first is strategic leveling and alignment, which is useful for treating rotated molars. The second, when treating rotated premolars, a couple force system is applied. Strategic leveling is to align the anterior teeth first and then derotate the terminal molar using an open coil spring. Space can be obtained by derotation of mesially rotated teeth. There are two ways to derotation. One thing is strategic leveling and alignment. Another is to use TPA. But in clinical practice, the control of TPA is not effective. On the other hand, strategic leveling can easily derotate mesially rotated teeth. It is not only easy to make a space, but also has a good effect in the treatment of Class II relationships. As shown in A, the buccal side of maxillary tooth 6 must be parallel, but there are many cases of mesial rotation as maxillary tooth 6 erupts. To solve this problem, open coil springs are used in 4 areas as shown in B. At this time, 016-022 SS with crown lingual torque and open coil spring are used to minimize labioversion of the anterior teeth. On the other hand, 0.16 NITI can be used when using an open coil spring on the posterior teeth after alignment of the anterior teeth first. What effect can we get? By rotating the mesially rotated first molar in parallel, we can obtain a space for the second molar with crowding to erupt. Tooth 13 has severe crowding. Tooth 17 of this patient was extracted and performed strategic bracket bonding. Brackets are attached to teeth 11 and 12, however. Since tooth 13 has crowding, it is recommended to attach the bracket later. Attach brackets to teeth 14 and 16, not tooth 15. Use an open coil spring to upright the mesially inclined tooth 14. There is not severe crowding on the left side. This is a case of unilateral crowding. If the tooth 16 is derotated by using the open coil spring, a space is made to align the maxillary canines. I recommend a method of obtaining space by derotation of the maxillary first molar through strategic leveling rather than TPA. In a case with mesial rotation with crowding like this, space can be obtained through parallel rotation. On the other hand, what about the case with parallel rotation with crowding? It is much more likely to extract teeth than in the case of mesial rotation with crowding. In this case, in order to make a space, it is necessary to expand the maxilla laterally or extract the second molar of the maxilla. When you make a diagnosis, you need to discriminate whether it is a mesial rotation with crowding case or a parallel rotation with crowding case, and decide whether to perform extraction or non-extraction treatment accordingly. There are many cases of mesial rotation of not only the first molar but also the second molar. This is because when the maxillary first molar erupts mesially rotated, the second molar also erupts mesially rotated. In this case, which tooth should be derotated first? Should the first molar tooth be derotated first? Or should the second molar tooth be derotated first? It is important to derotate the mesially rotated second molar first to make it parallel. The method to derotate the mesial rotated second molar is same with the first molar case. When using open coil spring in 3 or 4 areas like this, it is recommended to minimize labioversion of maxillary anterior teeth by using rectangular arch wire with crown lingual torque. After the 8 teeth of the anterior part are aligned first, the 8 teeth are grouped into one unit so that they act as anchors. And if you use an open coil spring on the teeth 5 and 6 areas, you can easily derotate the mesially rotated teeth. The thing to remember at this time is to solve the mesially rotated second molar first. Let's look at a case. There is crowding at tooth 22 area, and teeth 16, 26, 17, and 27 are mesial rotated. Initially, no bracket is attached to the tooth in front of the terminal molar. So if you use an open coil spring on the tooth 22 area, the tooth 26 will move to the palatal side lingual side. However, since the second molar is also mesially rotated, you can make a space by rotating it in parallel. After derotate the second molar, move the first molar is located on the palate side into the dental arch using an open coil spring. In this case, the crowding of the maxillary lateral incisors was first resolved. If you want to use open coil springs at the same time in the crowding area of the tooth 22 and on both sides of the teeth 6 areas, you can also use 0.16-0.22 SS wire with crown lingual torque on the maxillary anterior teeth. Let's take a look at how to treat the rotated second molars of mandibular. In some cases, only the mandibular second molar is rotated. In this case, as a strategic leveling, the bracket is not attached to the lower tooth 6 at first, but the bracket is attached later. If you use the open coil spring on the tooth 6 without attaching the bracket at first, you can solve the rotated teeth more easily. In some cases, the lower first molar and the lower second premolar may be crowded due to mesial rotation. In this case, use an open coil spring on the teeth 5 and 6 areas. It is recommended to add 1/3 of the length of the interbracket distance to the length of the open coil spring used. As shown in the picture, first solve the mesially rotated second molar of mandibular. If an open coil spring is used on tooth 5 area, the mesial rotated first molar of the lower is derotated. In the case of mesially rotated teeth, strategic leveling is performed for derotation, and meo wire is used at the finishing stage. What should the mandibular molars look like after treatment? It should be parallel and derotated as shown in the photo. The strategic leveling method for mesial rotated teeth is to first align the anterior teeth and use an open coil spring at the tooth 6 area. Then, the mesially inclined tooth is slightly uprighted, and the mesially rotated tooth is rotated in parallel, and the contact point between teeth 6 and 7 becomes slightly loose. Loosening means tooth 6 has room to go into place. In finishing stage, the meo with tip-back activation allows the mandibular posterior teeth to be actively uprighted. Next, it's about rotated premolar. A couple force system is applied as a treatment method for rotated premolar. A couple force system is to attach a lingual button to the buccal and lingual surfaces of a tooth and use an energy chain to direct two parallel forces outgoing in different directions. After applying the couple force system to arrange the teeth to some extent, you can arrange the teeth easily by using the NITI arch wire. Rotated teeth can be classified into rotations between 45 degrees and 90 rotation, and 180 degrees rotation. When the second premolar buccal side of the mandible is moved mesially in this way, it is called mesial rotation. When the buccal side of the tooth is moved distally, it is called distal rotation. How to treat the mesial rotation? As shown in Figure A, attach the lingual button to the lingual side of the first premolar, the lingual side and the buccal side of the second premolar, and use the energy chain. At this time, open coil spring is used only for just maintain the space. On the other hand, how to treat a tooth with a distal rotation. The lingual cusps are facing the mesial side. As shown in Figure B1, the energy chain is connected by attaching a lingual button to the lingual side of the first molar and the lingual and buccal sides of the second premolar, and the energy chain is connected between buccal side of the first premolar and the second premolar to derotate. If you can attach the bracket in accurate position as shown in B2, you can derotate the distally rotated second premolar by using an open coil spring on the tooth 6 area. This can all be decided on a case-by-case. Let's look at a case where the lower first premolar is rotated. In the case of mesial rotation, use an open coil spring without attaching a bracket to the canine as shown in Figure A. Or as shown in Figure B, attach the lingual button to the lingual side of canine and first premolar, and use the power chain to move the distal lingual cusps mesially. At this time, apply a couple force system to move the labial side of the first premolar to distally. That is, from the lingual button on the labial side of the first premolar, connect the power chain to the second premolar. There are many cases in which the upper second premolar is rotated. What should we do if it looks mesially rotated? Use an open coil spring on the second premolar and attach the lingual buttons to 3 places. Because of the mesial rotation, the lingual cusp is located in the distal position. Attach a lingual button to lingual cusps of the first premolar to move the distally located lingual cusps mesially. Use power chain between the bracket's hook of the first molar and the lingual button of the buccal surface of the second premolar. There are also a case of 90 degrees rotated as shown in Figure B. The most ideal bracket bonding position is to attach it to the buccal or lingual surface of the tooth. But if it is rotated by 90 degrees, it cannot be attached in clinical practice. So, as shown in Figure B, you can attach a bracket to the direction of moving the tooth into right position and apply force like this. In some cases, the teeth are rotated 180 degrees. In other words, the buccal cusp is located on the palatal side. In this case, you can return the tooth to its original state, but it is not easy. Therefore, it is recommended to finish the occlusion in this condition. The pictures are for mesial rotation of the first molars and palatal displacement of the second premolars. In the case of non-extraction treatment, the mesial rotated molar must be derotated first. Space is obtained by using an open coil spring in the second premolar area. After gaining some space, apply a couple force system. After attaching the lingual buttons to 3 places, connect the lingual button of the second premolar and the lingual button of the first premolar by power chain. And move the mesially located buccal cusp to distally into the dental arch. At this time, if there is a mesially rotated second molar, it is recommended to derotate the second molar first. In this case, there is a slightly winged tooth in the maxillary anterior and crowding in the second premolar, and the first molar shows mesial rotation. First, derotate the second molar and then derotate the first molar. Then, by applying a couple force system to the mesial rotated second premolar, solves crowding. Where should we put lingual buttons? When the lingual button is attached to the lingual surface of the second premolar and the first premolar and pulled it by power chain, the lingual cusp of the second premolar located in the distal position move to the mesial direction. Attach a lingual button or bracket to the buccal side of the second premolar and move it to the buccal and distal direction. In the mandible, anterior crowding and mesially rotated second molar can be seen. In this case, the basic of strategic leveling is to upright and derotate the terminal molar slightly using an open coil spring on the first molar area, without attaching a bracket, and then finish with me-of-you. If the second premolar and second molar are mesially rotated, what will be the outcome of the treatment by applying the strategic leveling and couple force system? You can derotate the mesially rotated mandibular second molar. In the case of rotation of the first and second molar teeth, strategic leveling is required, and the rotation can be solved by applying a couple force system in the premolar area. How should we treat the case with mesial rotation of the upper first molar? Use an open coil spring on the tooth 6 area to derotate tooth 7. In addition, you can derotate the mesially rotated first molar by using an open coil spring on tooth 6 and connecting power chain to tooth 6 and tooth 7 at the same time. There is a case of scissor bite on the second molar and mesial rotation of the first molar. This is mostly due to posterior discrepancy, lack of posterior space. How should we treat it? First of all, it is advisable to move the terminal molar into the dental arch. I use the TPA with hook appliance to move the second molar first into the dental arch. It takes about 1 to 2 months for the teeth to move. Then, use the open coil spring without engaging the main arch wire in the tooth 6 area. You can derotate the mesially rotated second molar tooth using an open coil spring. Then, if you use a power chain by light force on the first and second molars, you can easily derotate the mesially rotated first molars. So, you will be able to solve the problem of posterior part in a short period. Again, in the treatment of the rotated posterior teeth, the strategic leveling and the couple force system can be largely considered. What are the retention methods? It is recommended to use a general type retainer for rotated molar teeth and a bonding retainer for rotated premolar teeth. Let's think about strategic leveling and treatment duration. Strategic leveling is to align the anterior teeth first and then use an open coil spring on tooth 6 area. Normally, the period of using the open coil spring on tooth 6 is about a month. This can lead to uprighting and derotation of the terminal molars. After that, attach the bracket to the tooth 6 and finish with MIU. MIU is usually used for 3 to 4 months. The total duration of treatment depends on how quickly and efficiently the anterior teeth are aligned. You can shorten the treatment period by appropriately applying a strategic leveling and couple force system to these teeth with rotation and crowding. Thank you for watching.